I am Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine. And I want to welcome you to the webinar today. This webinar is sponsored by the American College of Veterinary Preventive Medicine and its partner organizations, the American Association of Food Safety and Public Health Veterinarians, the National Association of Federal Veterinarians, and the U.S. Animal Health Association. I want to welcome our guest speaker. Dr. Michelle Chang is a public health veterinarian at the Los Angeles County Department of Public Health. She's overseen the rabies, animal bites, and animal importation section of the Veterinary Public Health Program. During COVID-19 pandemic, she also co-managed the physician consultation line, where she addressed COVID-19 concerns and later monkeypox concerns from both the medical community and the public. Prior to working in public health, she worked in small animal practice. She received her veterinary degree from UC Davis and both her bachelor's degree and master's of public health degree from UC Berkeley. So welcome, Dr. Chang, and I will turn it over to you.
All right. I'm going to turn off my screen just to make sure that there's no technical difficulties. All right. So thank you, everyone, for being here today. I am extremely excited and so grateful to be able to present about animal importation and the implications on public health and animal welfare. So while my talk is entitled Animal Importation, I will mainly be emphasizing pet dog importation. And also, although I can only speak for what's going on Los Angeles County International Airport, the trends that we see in Los Angeles County are very similar from what I hear to what's happening at other airports around the country. And dogs coming in through Los Angeles are widely distributed across the entire United States, especially to West Coast states. So today I'm going to talk about, give an overview of the federal agencies involved in companion animal importation, risks associated with overseas pet purchases or adoptions, dog importation trends in Los Angeles, discuss some specific diseases of concerns and what we've seen in LA County be imported in, and discuss some challenges associated with regulating animal importation. I do have these slides that will be available, so I do want everyone to just kind of sit back and enjoy it. Any written information on here, you'll have a copy of the slides. Unfortunately, since I work for a public health agency that's local, I'm not going to be able to answer questions necessarily about the priorities or rules or regulations of federal authorities. Also, this talk is not meant to find immediate solutions for the issues I present, but more for further discussion. So just to start off, why should we all actually care about animal importation, right? Well, first, it poses a significant threat to public health, right? Up to 75% of emerging infectious diseases are zoonotic. There's been recent news articles about increasing cases of Brucella canis in both dogs and humans in the United Kingdom from animal importation. Here at home in the United States since 2004, we have had 8 instances of rabid dogs being imported, which resulted in 123 humans needing rabies post-exposure prophylaxis. There's also major economic impacts. So imported diseases can have impacts on trade with other countries. It can lead to culling of animals. This can drive up costs for animal products. There's also health costs associated for both humans and animals associated with prophylaxis or treatments. And also the cost of investigation if there is a disease coming in and an outbreak, that is our taxpayer dollars, right, paying for those public health investigations. Also, animal importation brings up issues of animal welfare. Oftentimes, entire groups of animals need to be culled to contain an outbreak. There's also ethical concerns about puppy mills and welfare issues related to shipping animals. Also, there's direct impacts on your community, right? Local disease outbreaks will affect you and your family. Our local animal shelters are already impacted and by overcrowding, and they can be impacted by disease outbreaks. There's ongoing canine influenza outbreaks that are closing some of the shelters right now. Yet, over 1 million dogs are still imported into the United States annually. And if a foreign animal disease is brought in, there will probably be a delay in accurate diagnosis of both pets and humans because it may just not be considered on a differential list, or results will be delayed because you have to send them to special labs to get the results. And then also, many foreign animal diseases don't have vaccines or treatments, or even if they do, they're difficult to obtain from just your regular pharmacy. And so I alluded to this just then, but CDC estimates that about 1 million dogs are imported into the United States annually. Focusing just on Los Angeles County, for LAX, Los Angeles International Airport, we are the 4th busiest in the world and the 2nd likeliest to play a significant role in the growth of a pandemic. We're second only to JFK, which is number 1. And then, like many other parts of the country, Los Angeles also has extremely active international rescue groups and a very strong imported puppy market. So this photo is from LAX. It's an entire pallet of French Bulldog puppies. And this is just at one airline. This is not out of the ordinary of what we see. So who's in charge of animal importation, right? Federal entities oversee animal importation, and this slide is just to show like there's a lot of overlaps in cooks in the kitchen, and each one is supposed to oversee just certain aspects of animal importation. So I'm going to focus on these 3 agencies. So our main 3 are going to be the USDA, the United States Department of Agriculture, CDC, and Customs and Border Protection. So just starting off with USDA, the Plant Health Inspection Service, they work under the Animal Welfare Act and the laws that were established under that act. And so I'm just kind of giving a brief overview of what they kind of deal with for animal importation. So this act, for example, will set age requirements for dogs depending on the purposes of the dog. So for example, if you're bringing in a dog for personal use, meaning you're keeping this dog, right? This is your pet, then the dog must be at least 8 weeks of age to ship it. Versus if you're importing the dog for resale or rehoming, or you're a rescue group who's going to adopt these dogs out and you're not keeping this dog as like your own personal pet, then the dogs must be at least 6 months of age. USDA also oversees the transportation aspects of importation, right? Like, is the crate big enough? Is there food and water? Is the airline following all of the rules? Also, people or businesses that adopt out dogs or exhibit them to the public, transport them commercially, or use them for research, they must be licensed or registered under the Animal Welfare Act, and they have to obtain proper permits. And then also animals are expected to be healthy, right? So they're interested in ectoparasites, screwworm, and these agricultural diseases. Versus CDC, their main focus is rabies. So then their requirements really depend on a dog's country of origin in terms of if it's a high risk for canine rabies or not. And so there's still over 100 countries that are considered canine rabies endemic, mainly in Africa, the Middle East, Asia, Eastern Europe, and South America. And so the requirements, depending on where the dog is coming from and how many people are bringing in, they can include different age requirements or CDC permits for these dogs, proof of rabies vaccination, rabies titers, certain types of microchips, and these dogs may only be able to enter the United States at certain airports. And CDC is also the agency who can issue temporary bans or suspension on dog imports. And they also expect that imported dogs are healthy, but they focus more on your non-agricultural infectious diseases, and they are interested in ectoparasites as well, just meaning that USDA has, the diseases that they're in charge of. CDC kind of has their diseases that they're in charge of as well. And then there's Customs and Border Protection, right? They're involved with just any goods, animals that are coming in. They have to meet federal requirements to basically get customs approval to come in. So they're the ones that can hold shipments. They can search people coming in if you bring anything, and then they can deny entry of shipment. So from this kind of a summary, right? Your federal agencies are the ones that they allow or they reject goods, animals into the United States. Versus your state and local agencies, right? We respond to what's already been allowed in. We can't deny entry or send any goods or animals back. We just respond to what has been, that's here. So that's why you'll see that a lot of your state and local laws are pretty short when it comes to animal importation and really kind of just focus on your rabies laws. Except in Los Angeles County, we are a little unique that we do have a regulation that actually prohibits the importation of sick or injured animals. And it allows us to issue health orders, including orders for imported animals cleared from customs to be seen by a veterinarian. We can issue isolation orders or quarantine orders, but we cannot deny the entry of an animal because that's under federal jurisdiction. All right, so LA has this law, right? But we're still not a federal agency. So how did we even get involved with animal importation, right? Like, how do I even know about anything going on? So the history of how we got involved was that in 2008, LA County started working with CDC and other federal agencies when multiple dead puppies were imported from Korea. And so at that time, right, the question is, was this just a one-time situation? Is this bioterrorism? Is this, what's going on here? So we did an in-depth investigation of multiple shipments and multiple airlines. And the major findings that we found were that a lot of these dogs were underage, as young as 6 weeks of age. They came in dead or were very sick. And there was a lot of paperwork fraud, right? This dog right here that has basically no teeth, these health certificates were stating these dogs were 6 months of age or just older than they actually were, and that they've received valid rabies vaccines. And then we saw multiple dogs per shipment that were just labeled for personal use. We saw inappropriate crate size for travel and a lot of animal welfare issues. So here are some photos from that period of time. So these puppies on your top left, right, these all came from one importer that was claiming these were for personal use, right, as for the USDA regulations, right, personal use, they have to be a certain age versus retail or a certain age. And these dogs look like this. They had no teeth. On your bottom left, this is inappropriate crate size for a dog, and this dog actually ended up dying because he suffocated. And then there were dogs that blatantly had injuries and were sick, and they had health certificates saying that they were healthy. And so from that experience, LA County continues to work with CDC and federal agencies. And this is kind of how we developed, this is kind of our basic protocol. So if a federal agency requests assistance from our team, they'll let us know about an incoming dog shipment, and they may need assistance from us if there's a lot of dogs coming in and there's not enough vets or anything that needs to happen and they need our assistance. We will go and we arrive at cargo facilities or a government bonded facility where the dogs are being held. And then we help conduct live inspections of animals. So we'll perform physical exams, health check status, check for ectoparasites, making sure there's no ticks or fleas, and then we match that animal to the paperwork. And then afterwards, we inform federal authorities of our findings. CDC does make the final decision if dogs are to be cleared for entry into the United States, and they'll let customs know to approve them through. But an example of how this collaboration works is that recently a few dogs that had respiratory signs were imported. CDC was able to authorize further PCR respiratory panel testing for them. But since CDC is heavily focused on rabies, once rabies was ruled out, I think something happened where they weren't necessarily able to hold the dogs long enough for these respiratory panels to come back. And so when LA County was notified, we were able to issue health orders immediately for quarantine. And make sure that, these dogs stayed in quarantine until we figured out what they were coming in with. And this collaboration is really important because we recognize that, laws do have gaps. And by collaborating together, you can kind of fill in some of those gaps in making sure that these dogs aren't out in public, potentially having zoonotic diseases, getting other people sick. But also, we can't always be there either, right? So sometimes we have to recognize there are gaps and things need to be fixed. So since 2008, we've been doing this for about 15 years. Has anything actually changed, right? There's both good and bad news. So the good news is that I definitely see older puppies and fewer dead puppies, right? I see some adult teeth on these dogs. There's definitely stricter pet travel rules at some airlines. So some airlines have taken it upon themselves to make rules, especially some airlines won't ship brachycephalic breeds. I have seen federal agencies definitely deny entry of dogs. They've fined airlines and importers, and they have continued to work on strengthening regulations. Also, a lot of the veterinarians I've worked on the federal level are they're very competent and they're very passionate about animal importation too. And also, pet seller scams have also increased, right, with social media. So that has helped with public awareness of risk associated with purchasing pets. And many imported dogs that we see are actually healthy and they're legitimate purchases, right? Like we see a lot of police dogs coming in from Germany and Belgium, or working dogs, or these special breeds. And then there is more peer-reviewed papers about animal importation that's coming out from several countries. And then there is more focus on One Health recently, and some federal grant opportunities. I'm going to talk about this later at the end of my talk. But with the good news, there is a lot of bad news, right? We still constantly see underage puppies. We see fraudulent paperwork. I still see sick and injured dogs regularly imported. In 2021, for example, in LA County, we had a large canine flu outbreak that was traced back to a rescue dog. And some dog shipments are actually cleared without proper inspection. There's stricter federal regulations for certain diseases like rabies and not others, and there's gaps in those laws. There's also airlines, cargos, and government, right? These facilities, there's employee knowledge gaps, there's staffing issues, there's budget cuts, especially at the federal government level and just government level in general. Depending on who's in charge, right, there can be changes. There's a lot of increased activity of international rescue groups in the last 10 years. There's a lack of public awareness or just unwillingness to accept disease risk. Social media and cancel culture is definitely real. So an example of this was there was a shipment of animals, and there was a dog that was sick and was a rabies suspect, and it needed to be held while we were investigating. And with social media, a group was able to get to basically say, you know, they're holding these dogs, and they came out and protested in front of government agencies and in front of these cargo facilities. And a lot of veterinarians who are part of this and at every level of government can actually be targeted, and, you know, people posting terrible things about them online and trying to cancel them. But in summary, we just know that the current federal regulations are insufficient to prevent disease introduction and ensure animal welfare. So I want to move on to what are actually the animal importation trends that we're seeing in LAX. Again, from what I hear, this is the general trend across the United States and also in other countries. And there's kind of just two separate issues. So this first issue is imported puppies, right? And what type of breeds are those? I like to categorize them and basically call them Instagram social media breeds, right? These are your French Bulldog puppies, your Pomeranian puppies, your little Yorkie puppies, and all your teacup poodle doodle mixes. These dogs are coming from places like South Korea, Russia, Ukraine, Moldova, China, Colombia, and Hungary. And as you can see with the asterisks, a lot of these countries are canine rabies endemic. And these are being sold online as locally bred, healthy. I've seen them from $2,000. I actually saw a French Bulldog puppy being sold, being advertised for like $13,000. Or an importer will actually import multiple puppies, bring them all home, give them baths, and then resell them here as if they were bred here. Or they'll use them as breeding stock for here and start selling them. We see a lot of scams associated with this, right? People will show up and no dog shows up. The dog is different than the one that's promised, or a dog is sick. I've seen a lot of dogs with hypoglycemia, respiratory infections. So many puppies come in with parvovirus because they're too young to be fully vaccinated. We see a lot of cases of distemper and just parasites, or you just get a dog that has just poor breeding. And so this is what I mean by Instagram puppies. So literally just go on Google. I just Googled image and just typed in Instagram puppies. And right, this is what you see, these like teacup dogs that are so adorable. They're dressed up. This is what people want to buy. And I'm sure people who use social media, right, you see what's popular and what drives what people want. And then, you know, just last year, French Bulldogs were the most popular breed dogs in the US. And then just showing that picture again, right? This is just a whole palette of French Bulldogs that came in. And so how did we even get here, right? What factors contributed to this problems of imported puppies? So social media and the desire for specific designer breeds is a big part of it, right? These videos are adorable. Everyone's looking at it. Of course you want one. And then it's also an unintended consequence of regulations that were put on pet stores and puppy mills in the United States. Not that they shouldn't have, not that these regulations shouldn't have been put on them. It's just the unintended consequences that it strengthened international puppy mill markets. And also because puppies are emotional purchases, right? And oftentimes they have this purchase target date. I have to get this for Christmas. I have to get this for Valentine's Day. It's so-and-so's birthday, right? Like there's a date, you need to get it. I want it. So if you go to responsible breeders, you may have to be on a wait list. A lot of rescue groups sometimes will have you fill out a lot of paperwork, and what you need to have in order to adopt from them is not necessarily realistic at times, or your local animal shelters may not necessarily have what you want. So there's this perceived shortage of puppies that doesn't actually exist, but it seems like that when you're trying to make this emotional purchase and you have a very target date that you need to have this puppy by. And then there's also a lack of awareness and education about international puppy mills, right? These websites are very professionally designed. These dogs are advertised as being very locally bred. And most of all, it's just really easy, right? You just click and you purchase exactly the color you want, the breed you want. It's available. You make the transaction. You don't have to go searching anywhere. And then in general, right, there's just minimal education, public education about pet ownership in general. So the next issue is imported rescue dogs, right? We've seen a significant increase in dog importation by rescue groups, and the countries of origin for these dogs is Asia. So we see dogs coming from China, Taiwan, South Korea, South America, and the Middle East, and also anywhere where there may be a current disaster, either wars, hurricanes, earthquakes, anything like that. Like people will try to get these dogs out. And most of these are adult dogs, and they may be rescued off the street or on vulnerable environments, or sometimes just the shelter. But depending on where they're from, this can pose an even greater risk for harboring infectious diseases, right? Because you don't really have a history on this animal. It's never been vaccinated. Rescue groups also may have limited funds, and they have limited time to adopt out these dogs. So there's an inability to properly diagnose or treat foreign animal diseases. And also, we've seen some rescue groups misrepresent the history of their dogs, right? They'll try to sell sob stories for profits. This is a business to them. And we see very similar humane issues as with imported puppies, right? They're all going on these very long flights, no food or water. They're sick or they're injured, and if there's a flight delay, they can be on these planes for, 20 hours. So since 2004, we've had 8 instances of rabid dogs being imported into the continental United States. You'll notice that every dog here, every case involved a rescue dog. And in that fourth column, you'll notice how many humans needed rabies post-exposure for each of these. And also how much money it cost in resources. So in 2019, the rabid dog that came in from a rescue from Egypt, that public health department was able to quantify. They estimated 800 hours in resources and, $214,000 in personnel time. And this is going to be your taxpayer dollars for that. This is a video of a dog that came in through LAX. And so we marked this dog as a rabies suspect because it was neurologic. And although it did pass quarantine, it was cleared. It's really sad to know that a dog that looks like this and was, had these health problems was in a crate for over 16 hours. And here are just some animal diseases that have been imported into Los Angeles. We in Los Angeles County, we know about some of these diseases because certain animal diseases are actually reportable to our veterinary public health team. And so both our canine influenza outbreaks were traced back to imported rescue dogs from Asia. because we have the authority to issue health orders and quarantines and have very good relationships with veterinarians in our community, we were able to control these outbreaks before they completely took off. But I would say in 2021, right, we still had 1,200 cases and there were 21 deaths. I do fear that if there's another situation that happens, I don't even know if I can say like, we'll be this lucky to keep it that small, because that's a big outbreak. But I know compared to other areas that have had massive outbreaks, we're lucky in the sense that it didn't go into our shelters yet. Heartworm is not very common in Los Angeles County as compared to other regions of the United States, but a large proportion of our cases recently are imported from different countries, and we do have a lot of mosquito vectors, and so we are seeing more local transmission. We're also seeing a lot of increasing cases of Brucella canis and also Ehrlichia. And then in 2004, right, we did import that one dog from Thailand that was a rescue dog puppy, and it had rabies. We've also had a case of melioidosis in an iguana. And then for leishmaniasis, we know for sure there's 4 dogs. We're actually investigating a possible 5th dog from Turkey this week, and we're just waiting for those results. And then we actually had a case of difilarial repens in one dog that was actually imported from Hungary, and the vet was neutering this dog and was pulling out adult worms just that was in the scrotum. And difilarial repens is more zoonotic than heartworm. And then what are the diseases that could be on the horizon, right? I know all of us have our favorite foreign animal disease, and all of us together could make a huge list of possibilities. I just picked these 2 because I'm personally interested in these and also very terrified of these 2 diseases. So novel influenza viruses, these all have pandemic potential, right? And then severe fever with thrombocytopenia syndrome virus. It is a tick-borne virus. It is zoonotic. The mortality rate can be very high. And even though it's tick-borne, they've also shown that direct transmission can happen or through fomites has been documented. So here's just a paper that was written about H3N6, which was circulating in China. And the vaccines that we have here for canine influenza, we have H3N8 and H3N2. So if H3N6 was introduced, right, I don't know what would happen and how big of an outbreak that could potentially cause. And they did find that for H3N6 canine influenza, it showed increased mammalian adaptability. And these were just 3 papers that are very good reads. If anyone does have the chance, definitely look these up and read them. Just for severe fever with thrombocytopenia syndrome, it's zoonotic. And these infected ticks can easily be imported into LA County or anywhere in the country from the affected areas. So we definitely need to have better pet regulations to make sure that these ticks don't come in too. And so, sorry, I should have mentioned, I do have some graphic pictures now that I wanted to go through, and these are some more recent inspections that we've done. So starting from the top left, this was an imported dog that had watery diarrhea. Next to it, this was a dog that was part of the same group, and it was imported with respiratory infection, and this dog progressively was getting worse. We also have this puppy on our bottom left that came in with a rectal prolapse. And then this dog on your bottom right, I still kind of get emotional talking about this dog. It was probably the worst case that I still remember. So this, of course, was a super, super sweet dog. She was shepherd mixed. She was imported through a rescue group. So her left front limb was already amputated. And so she only had her right front limb, but they had open wounds and these associated swellings with that arm. And she'd been on a flight for 15 or more hours and was just covered in her own feces, right? Her wound had fecal contamination in it. And this dog was issued a health order where she was ordered to see a veterinarian immediately. And they took her to the veterinarian, the rescue group, and then she was euthanized the next day. And so I think about this, and this dog should have never had to suffer through a 15-hour flight, right? Just to come to an unfamiliar environment and be euthanized. This dog came in vomiting and lethargic, and on physical exam, and just by looking at her, I suspected that she was pregnant. I was very lucky that there was another vet with me at the time that had an ultrasound machine, and we were able to confirm that this dog was pregnant. She was stuffed in a crate, and she was on a flight that was over 13 hours. And here are some other rescue dogs who, I would say they have more common problems, I guess. But when I say common problems, I just mean that I don't necessarily think these are things that are very difficult to treat, right? We have just a dog who's like sitting in his own urine, who could have been bathed, a dog with severe matting where I feel like someone could have just shaved this dog. This dog had bilateral ear infections. I can't even imagine being in a crate in cargo where it's super loud, having bilateral ear infections. I can't imagine how uncomfortable that would be. And then this dog had, a huge hot spot. And so it just makes me wonder, right, for some of these things where treatment could have started in that country, because, shaving a dog, you don't need that much. If these simpler type of diseases can't even be treated, or treatment can't even start, and we make excuses like, oh, well, it's okay, they're coming over here for better lives. I'm not very confident that all of these dogs necessarily got their vaccines or any testing was done for any infectious diseases. Here are some French Bulldogs that were advertised as champion bloodline French Bulldogs. At the time, they were being sold for over $2,500 each, depending on what color that you wanted. And these are some of the things we saw. So this is someone who brings in a lot of French Bulldogs and then will take them home, clean them up, and then, pretend that they bred them here. So I'm not really sure what the patchy hair loss was. Could have been ringworm. No idea what it was, but if I was spending $2,500, I definitely wouldn't want that. This dog has an umbilical hernia. This female dog had a very recessed vulva, and then this other dog was just covered in diarrhea. So I don't know if this dog actually could have potentially had parvo or parasites. But again, these are your champion bloodline French Bulldogs that are sold online for over $2,000. And then there's also just poor breeding, right? Like, this dog was imported, and already just by looking at it, right, what kind of quality of life is this dog going to have, right? With malformed small nostrils, already has cherry eye, right? That needs to be fixed. All of this extra skin is going to probably have to see a dermatologist. What's going to happen if an owner who takes this dog can't pay for this dog anymore or doesn't want to, right? These dogs are going to end up at shelters, and our shelters are already very full. And so I talked about this a little bit in my slide about what are some good things that have happened with One Health funding. So recently, the Veterinary Public Health Program, we received a One Health grant, and we literally just started, and the grant is for 2 years and allows us to do PCR testing on just a single oral pharyngeal swab. And this includes dogs and cats that were imported through rescue groups, dogs and cats returning to the United States after traveling, dogs and cats that were purchased as puppies and kittens, and also covers dogs and cats from high risk and low risk canine rabies countries. So we're trying to get samples from dogs and cats that came from anywhere across the world. So far, we've been able to sample 38 animals, so 32 dogs and 6 cats, and that covered 14 different countries. And we've had 1 presumptive positive dog for SARS-CoV-2, but no animal has tested positive for influenza. So it's good news that at the federal level, there is enough interest that there are One Health grants. So it seems like somebody is interested, and that is a start, right? And so for education and awareness, so I guess my last slide is kind of, what are some things that we can actually do, right? The point of my talk isn't necessarily to fix these problems, because honestly, I don't actually know what to do. And I don't have the answers for all of these things. And animals, they generate a very emotional response from the public and within veterinary medicine, since we all care and love about animals. For our team, and some of our goals that we think that we can do is education within the veterinary community. I don't think a lot of veterinarians actually know that this is going around, or at least to this degree, around the entire country. And I think, giving this talk today is something that I'm really excited for because I get to reach other groups. We also give lectures at certain veterinary schools and to LA County veterinarians, but I definitely feel like we need to talk about this more across our profession. We do try to educate clients and the public, and some challenges there are that some people don't want to know about it. Some people will listen, but won't necessarily do anything different. We also educated some rescue groups and also have had different responses, right? We've worked with rescue groups that were incredibly responsible. And after they learned about this, they definitely started implementing testing, and they, asked about PPE, and they didn't know about these diseases, and they've created different protocols. And then there are actually groups that, don't believe rabies is a problem and don't really want to listen to what we're saying and just want to continue what they're doing. I also put supporting policy change as something that we need to do from a veterinary profession, right? And it sounds really, I'm just putting it there, but I don't necessarily know how to do that. I just know that if we do want policy change and to support policy change, we need to do it as a group in our profession, because if we don't come together as a group, then people making these policies are not going to be in veterinary medicine, and they're not going to necessarily understand the things that we do. And then the third thing that I think was really important is reporting diseases to public health. So it's great that we do actually have a federal infrastructure, right? There's reportable diseases, so that's already in place. And also, it might not be realistic for a lot of people, right? Some jurisdictions don't have, veterinarians at their public health department that they can report to. Some diseases are not reportable in certain jurisdictions. So how does that help? So really focusing on educating veterinarians to know, how do you report? When do you report? What tests you should run are things to consider. But these are just kind of three big broad categories. And kind of the purpose of this talk is to get discussion. Like, what are thoughts that other people have? What are things that we could do? And so that's kind of where I'm ending it, because I wanted to add some time for us to have discussion or to ask or to do Q&A.
Okay, wonderful, Dr. Chang. I will go ahead and kick things off with the questions. One question I had, Dr. Chang, is obviously you're focused on Los Angeles County being the significant location for importation of animals. Are there similar processes, similar problems in other parts of the United States?
So to answer your question, from what I've heard from different agencies, what we see in LA County is definitely not unique. This is a trend happening across multiple jurisdictions at multiple airports, and a lot of the importers are the same, right? They're business, so they're just trying to import dogs into where they need to go to, and whoever is trying to import them. So although I haven't been to the other areas, from what I hear from the people that do work in those areas, nothing here is necessarily unique, right? These trends are similar across the United States and at different airports.
Okay. All right. I'll go to the Q&As. Dr. Shaw was questioning, this was relatively early in your presentations, questioning ID requirements and whether microchips are required for imported puppies, or if there's any other types of ID requirements for imported animals.
Yeah, so CDC really looks at those. And so and on their website, they do put it out there. But for dogs that are coming in from rabies endemic countries, and are more than 3 are being brought in, they do need to have an ISO compatible microchip. They do need to have proof of rabies vaccination. They do need to have serological testing for titers that is done at a specific lab that CDC has put on their website as where they should get it done. And then they do have to fill out permits, and all of that information has to match. But technically, for dogs that are coming in from non-rabies endemic countries, it's just highly recommended that you get a rabies vaccine. But that's kind of a big loophole if you think about it, right? Like, you can just come in from a rabies-free country and just say that the dog was from there, and then you can kind of circumvent the other things that the other requirements. So that is kind of a big thing that people do to get their dogs in.
In the chat, Dr. Solomon asks, at the local county level, how effective is the International Animal Health Certificate or Animal Passport from the European Union?
So I'm not sure if I understand the question correctly, but we don't, so from a county level, we don't necessarily look at the passports, right? When I don't necessarily look at any of the pet passports once they're already cleared from customs, right? Like these dogs are here regardless if they have paperwork or not. I can't send them back. The passports are going to be looked at by CDC. So depending on what their requirements are from that country, that's how the dogs enter. But for LA County specifically, we don't necessarily act on them, except we can let the jurisdiction where the dog will be residing know and let them know, like, you need to follow up with them so that they make sure that their dog is vaccinated for rabies. But outside of that, we can't, the passports, we don't necessarily deal with. And then the director of our program is on as well. And so she's on the panel.
I was just going to say, in the past, we've done surveys at the airport with CDC and found out that the health certificates, it depended on the country in Europe on whether they were accurate. Unfortunately, in the Eastern European countries, there's still extensive fraud. And so a lot of animals were coming from Eastern European countries, and they were saying they're 4 months old and they're actually 6 weeks old. So it really varies country to country. And you can't, just because it's a European passport or health certificate, assume that it is accurate.
All right. A question regarding the Healthy Dog Importation Act that was recently introduced in Congress and supported by the AVMA and other animal health organizations. Do you have any comments on that? Are you familiar with it? And do you believe it will provide some assistance in this problem?
I can speak to that. I was on AVMA Council on Public Health until last year, and I had been talking to them about animal importation for the whole 6 years that I was on that council. And finally, AVMA was pushing forward on this Healthy Dog Importation Act. It is good to an extent. It would create a law, but unless there's funding behind it, it may not be enacted. And so, many laws are passed, and if they aren't funded appropriately, they're not really effective. So the law is the first step. And then the second step is to ensure adequate funding and that there is sufficient federal staff at airports and ports of entry, to be able to enact the law and actually check. Because if you just look at paperwork, we found out, well, unfortunately, you can't trust health certificates from overseas. During surveys, we found up to 40% were falsified. And so, we really need to fund the federal agencies to a high extent for this to work.
A specific question about the severe fever with thrombocytopenia syndrome. What species is it most common in? Where is it endemic in the world, and what type of ticks are indicated in its transmission?
Okay, I was hoping that Emily was on because that's her favorite.
That's her expertise. I don't see her on.
I don't see her on anymore. She was on in the beginning. But for severe fever and thrombocytopenia, they're infected. It's the Asian longhorn tick. So it's Haemaphysalis longhornis ticks. And they are, so where we're seeing the disease since 2009 spread has been in areas of Asia. So there's cases in Japan, they've seen it in China as well. And this tick can be easily imported from livestock animals, or they've seen them in dogs. So just like any other tick, you can import them easily just through animals, through bedding. But right now where it's more endemic, or where you're seeing the published cases, is from areas of Asia.
Okay. Back onto one of your slides, the neurologic, the dog that you had the video on, the neurologic. Was there any follow-up with the importer And I guess as a follow-on, I guess I would ask, I mean, how much follow-up is there routinely with importers of these dogs that are found to have problems like this?
Yeah, so my role when I go to LAX is I am assisting CDC and USDA in terms of, right, there may be a very large shipment of animals and they just don't have enough vets to necessarily get through this and be able to examine them in a proper amount of time. So we'll go out there and do it. And so they're in charge of the follow-up. But for cases like that, right, they can follow up with the importer and with the airline about not following rules for potentially like the crate size. They can fine the airline. They can fine the importer for bringing in dogs like that. I am not privy to a lot of what actually happens afterwards, right? After I give my findings and what my recommendations are, they are able to, based on their laws, decide, who should be fined, if it needs to go to, and like during quarantine, where it's being quarantined, if there's fees associated with that, right? The airline or the importer has to pay for it. Any test the importer or airline has to pay for. But in terms of the follow-up for them, if it is cleared of rabies, these animals are coming into LA County, but I don't actually think that particular dog ended up staying in LA County. I think like shortly afterwards, it was transported to another state.
Okay, we can do a couple more. And someone asked, could you speak to some of the regulatory changes being proposed from a rabies standpoint, particularly any changes associated with dogs and cats being imported from high-risk countries?
Karen, I'm going to have you take that one.
Well, CDC is working on regulations to try to improve the oversight of animals coming in from the rabies endemic countries. And so they put in temporary requirements, but the new regulations are to, finalize, and that it will etch it in stone, basically, that animals coming in from rabies endemic countries, will need to have a microchip, will need to be vaccinated beforehand and have titers, have permits. And so we very much support, CDC getting these procedures into regulations so that they can't just be removed again. If somebody gets upset with the restrictions and complains to their congressman about importing animals, things go up and down with regards to federal regulations based on politicians often.
One more from the Q&A, and then we might try something. We might activate a couple people's microphones and let them ask questions live. Are there any additional biosecurity measures taken on those animals that are imported that you guys find with, health and disease findings? Are there any special or additional biosecurity measures taken?
I think we can speak to like the canine influenza cases would probably be our best example. So for canine influenza specifically, we were actually sending out quarantine orders, and staff would actually go and make sure that they were following orders. For certain other diseases, so I would say like for parvovirus, for example, like we didn't necessarily know the dog had parvo, but they would go to a veterinary hospital and the veterinary hospital would diagnose them and then report it to us. And then in our form for reporting, there's the question of where did this animal come from? And so they'll let us know. And then from that, our veterinarians in Los Angeles County do have enough, and we do try to educate them enough about foreign animal diseases, but when they see private veterinarians for diseases that are also endemic in the United States, they're able to just give them the regular recommendations for quarantine and isolation from other dogs. But for something that was more of a foreign animal disease, I would say for like canine influenza, we definitely had like special quarantine orders where we would quarantine an entire facility, give them recommendations for cleaning and that type of follow-up. But I guess the big hole is that we don't necessarily know some of the diseases that came in, right? So for a lot of these leishmaniasis cases, we didn't see it on the animal when it came in. It was diagnosed months after at the veterinary hospital, and they're the ones that let us know, and then we can follow up. Some of the cases of like Brucella canis, for example, we didn't know about those cases, and it was the veterinarian that was working with the rescue group that ended up diagnosing the animal. So we will put in quarantine orders for certain diseases and then put in health orders if an animal is actually sick, to be seen by a veterinarian. And then depending on what the disease is, and sometimes they are just endemic diseases that we have here. And then the veterinarian that is treating the animal will be able to help with that education. Did that answer the question?
I think so. I mean, it's clear to me. And then one final typed question, are there any actions taken against these importers, such as a violators list, that they are no longer allowed to import animals when problems like this are found? I mean, is there any action that can be taken in that respect?
So there's been a couple cases, actually. So there was someone about 15 years ago, I would say, that was importing puppies, and she ended up getting in trouble because she was practicing veterinary medicine without a license. And so what ended up getting her wasn't the fact that she was importing puppies, but the fact that she was injecting them with gentamicin. And it ended up that all these dogs were super sick. And then she brought them into a veterinarian, and a veterinarian who alerted us about it. And this happened in a different county than LA, but we work closely with the other groups, other jurisdictions. But, she got in trouble for practicing veterinary medicine without a license. And so I think a lot of the consequences are related to practicing veterinary medicine without a license. And then I don't know what lists the federal government has. Like I said, I just work with the physicals and do that, and they kind of put their fines on. But I know that they recognize that there's certain people that are problem importers, but I don't know if they're actually taking action. They could definitely be taking action. I just wouldn't know. I know that they have fined places. I know they fined airlines that ended up getting a lot of fines, that they changed some of their rules. And something did happen, right? Because we are seeing puppies that are older now. So something did happen. I'm just not necessarily privy to all that information.
Okay. And then I'm going to go ahead, and one last thing that I saw in the chat, I saw a discussion regarding other species of animals. Your talk was focused on primarily puppies. Do you see any large animals, equine, bovine, exotics? Likely not to the same magnitude would be my guess, but do you see similar problems in other species?
We don't work with the large animal inspections, but I have definitely seen veterinarians from USDA, because they're responsible for doing those. And so from what I've heard and what I've seen, because we're physically in the same cargo space sometimes, like they definitely, are looking at the animals. They're making sure there's no ectoparasites. They're looking at bedding. They're looking at what what they're coming in on. They're inspecting it that way, but I've never had, we don't do inspections like that with CDC. So that's more of a USDA veterinarian inspection.
I'm going to talk about a little bit earlier, back in 2008 or 9, before Michelle was with our program. We did all animals for our surveys, and we did find that USDA had a really good system. That they were, meeting the livestock. They were setting up a time. The veterinarian was paid to go and take the animal to a quarantine if it needed to be. With the Department of Fish and Wildlife, we did find that their focus was on species and not necessarily on the health of animals. We did run across situations where, such as there was a bunch of reptiles that had been rejected by Canada that had been sent up there because there was some other illegal spiders in the shipment, and they shipped them back to Los Angeles, and they just sat there until most of them died. There are some gaps in the wildlife importation, because the focus is really on species and not so much on health. And a certain percentage of, like reptiles being dead is considered normal. And if they're not a threatened species, they're just disposed of, and there's not an impact on the importer. So I would say on the wildlife side, great on identifying species, but we need more monitoring of the health of animals, and maybe necropsies on the dead animals that come in.
Wonderful. Well, we are at our hour. I am going to turn it over now to Dr. Bob Larson, the chair of our continuing education committee, to see if he has any final comments.
I do not. I do want to thank Dr. Chang. I think this has been a great presentation, and thank you for everyone for being here. These webinars have been really successful, and we will continue to look for good speakers like Dr. Chang.
And if you have any ideas of speakers you'd like to see, or if you yourself would like to give a presentation, you can email the ACVPM. You can email me at admin@acvpm.org, and I can get those into the Continuing Education Committee's hands. So once again, wonderful talk, wonderful, it's not a wonderful topic, but it is a wonderful talk. It is a topic, a timely topic, and a topic that all veterinarians should be aware of. And we very much appreciate your presentation, Dr. Chang, Dr. Ennert, and we thank everybody for attending.